Hi viewers, I'm Dr. Ruchira Ganachari, a dental surgeon at Eledent. We have two branches, one at Kondapur and the other one at Kukatpally. Today I'm going to discuss with you 5 good and 5 worst habits in your oral hygiene basically. So the first 5 habits that I'm going to talk are the worst ones. Let's start with the first one, which is called toxic toothpaste. People tend to use a variety of toothpaste without really knowing all its ingredients. So the basic thing that you can always remember is make sure you do not use a high fluoridated toothpaste. So this is one thing that you should try avoiding. Try reading all the ingredients and try knowing which toothpaste you're not supposed to use. The common one is not to use anything which has a higher fluoride content. Second one is people try to brush their teeth right after having a meal, so which is a very wrong thing. So what happens is right after you eat, the pH in your mouth or the pH value of your saliva is pretty high. So say it is on the acidic side. What happens if you try brushing in that time is, with the paste that you apply on your teeth, you have enamel. So this enamel starts to erode, or rather say starts getting abraded, because of which you might tend to have future sensitivity or stuff like that. So it is ideal that you try to brush your teeth half an hour or 30 or 45 minutes right after the meal. So say if your meal is at 1:30, try brushing at 2:15 or say probably 2:30. This is how you could help yourself in not spoiling your teeth further. Thirdly, something called as cleaning of your tongue. Cleaning of your tongue is highly recommended because your tongue itself has a lot of bacteria present. The way you could do it is by using a tongue scraper. So usually any type of tongue scrapers are available in the market, but I personally suggest everybody to use something which is made of copper, which tends to remove maximum amount of bacteria. Next one, coming to the way you brush your teeth. People usually say we brush for 5 minutes, we brush for 3 minutes every day. It's not on how much time you brush for, it is rather how you brush. So when we say that the way you are supposed to brush is in a way that your upper teeth have to be brushed upwards to downwards. So a little bit of the bristles that are present on the brush are supposed to enter a little bit into your gums so that your teeth cleanse well. So on the upper front teeth, this is how you will do it. On the lower, you will brush it from the lower part to the upper part. And on the teeth present on the behind, you will go in a circular or in an 8 shape motion. So it's either circular or 8 shape, upwards to downwards and downwards to upwards. This is your basic brushing technique, on which I will speak in further videos. But for now, this is how much you should know about how you're supposed to brush your teeth. Next one, coming to tooth picking. So tooth picking is one thing that everybody should avoid. When I say tooth picking, means you are picking your teeth with a toothpick, or say nail biting habit, or this is all something that you should be avoiding. You cannot use your mouth as a toolbox to do all these stuff. So now I'm going to talk about 5 good habits that you can do in your daily routine life. Starting with 1, wash your mouth after every meal. People say that we wash our mouth properly after every meal, but you need to wash your mouth for at least 30 seconds right after you eat. So put your water in your mouth, gargle it well for 30 seconds. So what happens when you gargle well is all the food particles that are left off in your mouth tend to come off when you cleanse it well for 30 seconds. Secondly, oil pulling. Oil pulling has been there with us from a very long period of time. So this is one of an ancient technique, or rather say old school way of keeping your oral hygiene neat and clean. So what happens is in oil pulling is you use different types of oils, because of which there is osmotic pressure that has been created. So when you use these oils in your mouth or to massage it anywhere, you tend to have pinker lips, or you tend to have healthier gums, and you tend to have lesser decay, or say negligent amount of decay present on your teeth. So this is another method that can be done. The third one is what I'm going to tell you is using an abrasive powder, or let's say a massaging powder. You can mix this with some type of oil, say clove oil or sesame oil, and massage it on your gums. So when you try to massage this on your gums, it is directly related to your intestines, which indeed causes or makes you have better bowel movement. The fourth one that we are going to mention right now is about using sticks. So when I'm talking about sticks, doesn't mean your toothpicks. What I'm trying to mean is using a neem stick or a bamboo stick. Chewing on these, the oils that are secreted are really good for us. So in a way, you can say we are going a little bit of old school, or rather say we are doing a little bit on the Ayurvedic side of this. This really helps in making sure that your teeth are well maintained or your gums are well maintained. Last but not the least is the fifth one, that is called exercising of your teeth. Must be sounding very weird, like our body needs workout, our teeth also need workout. So each time when you have a meal, you tend to eat a bite, you eat it bite by bite. So when you take each bite is supposed to be chewed at least minimum of 30 times. That is when the food is properly chewed, and that's when you tend to swallow it. When you chew your food for 30 times, that means your teeth are having enough action going on around it. So this is how you can, classify between 5 good habits and 5 of the bad habits. And when you use this in your daily routine life, you tend to avoid going to a dentist more often, and this is how you can maintain your oral hygiene. Thank you.